Hi, my name is Dr. Fred Sylvester from New Hanover Chiropractic, and welcome to this episode of Health Talk. Today we have a very exciting guest on our show today who's going to give us some information about pneumonia. Dr. Singh is new to our area. He is the owner-operator of the Urgent Care in Gilbertsville. He graduated from Michigan State in 2011, and we welcome your expertise today.
Thank you.
Absolutely. So today we're going to talk about pneumonia, and we're getting closer to the, we'll say the flu seasons and all those other types of seasons that kind of come up as we start to move through, as people start to move indoors. So why don't we start off? What is pneumonia?
Pneumonia is a lower respiratory tract infection.
Mm-hmm.
It's basically your lungs get infected,
Mm-hmm.
sometimes get filled up with a fluid,
Sure.
and that is called pneumonia.
Okay. So what type of, there's different types of pneumonia and there's different types of severities of pneumonia.
Mm-hmm.
Can you expand to our viewing audience about what we should be looking out for and what should be going on with the different types?
Sure. Common types of pneumonia are viral and bacterial pneumonias.
Okay.
There is a third category of pneumonia as well called fungal pneumonia.
Sure.
The name itself says the causative organism. In viral pneumonias, it's the viruses which typically cause the pneumonia, and
Mm-hmm.
bacterial pneumonias is the bacteria. Fungal pneumonias typically happen in people who are immunocompromised.
Oh, okay.
So those are seen less commonly,
Sure.
and any of these pneumonias can make you sick.
What are some of the signs and symptoms? Are they all the same, or how?
Except for fungal pneumonias,
Mm-hmm.
viral and bacterial pneumonias can have pretty much the same symptoms. In
Okay.
fact, some of the viral pneumonias can start as a viral pneumonia and get complicated with bacterial pneumonias later in the stages of
Sure.
of the illness. Common symptoms are fever,
Okay.
chills, body aches, malaise, rundown, and when you start seeing shortness of breath,
Mm-hmm.
work of breathing, difficulty in breathing, those are concerning symptoms. You should go see somebody right away.
So can this often be confused with just a run-of-the-mill cold?
Yes, cold is actually called upper respiratory tract infection,
Yeah.
and many of the, or most of the viral infections actually start that way.
Sure.
And in most of the patients, more than 90% patients, they will get better without turning into something serious.
Gotcha.
But occasionally these can turn into lower respiratory tract infection,
Okay.
and especially in patients who have some comorbidities, like
Sure.
somebody has COPD, somebody
Sure.
has asthma, or is immunocompromised for any reason. Yes, those colds can turn into something serious.
So as we were doing some of the research preparing for the show, worldwide there's like 450 million cases of pneumonia, which I was totally astounded by at this
Yes.
point. What do you see the prevalence locally we'll say in the United States, around the area at this point? Is it that high? Do you have that high of numbers, in, we'll say, the developed countries versus undeveloped countries? And what would be the reason if there's a difference?
Yeah, there is significant difference in incidence of pneumonia when you compare with developing countries. But even in the U.S., it continues to be top 10 killer of killer disease in the I think it was 9th in 2016.
16, right?
Yes, and in Pennsylvania, I think there were about 2,500 deaths in 2016 secondary to pneumonia.
That just amazes me. I
yeah.
would never have thought that.
Mm-hmm. Yes, and I think the biggest difference we have between developed and developing countries is the vaccination and standard of living.
Sure.
Pneumococcal vaccination given to kids under 2 years of age and elderly more than 65 years of age. It has consistently shown in studies that it decreases chances of contracting a bad pneumonia.
Sure.
The common bug or common bacteria which causes pneumonia is strep pneumo.
Okay.
And this pneumococcal vaccination, it helps to protect you from that.
Gotcha.
Second most common bacteria is called H. flu or Haemophilus influenza.
Right.
And we consistently vaccinate our kids here in U.S. Actually, that's done in some of the developing countries as well.
Sure.
But here in U.S., we consistently, CDC recommends doing those vaccinations, and that has consistently shown decreased incidence of contracting those bugs.
I think when I was reading since 1938, I think that we've been seeing a steadily decline in pneumococcal deaths per se, and I think they're saying that's 100% related to the vaccine itself. So who's most at risk for contracting, we'll say, any type of pneumonia? Because sometimes we think that strep is just a common part of the flora. So how do we contract it, and who's more at risk?
Sure. Kids younger than 2 years of age, and elderly more than 65 years of age.
Okay.
Those patient populations are at the highest risk.
Okay.
So the immunizations are targeted for the same patient population as well. There are other patients. If somebody has any end organ disease, for example, if somebody has heart failure, kidney failure, liver failure, or any problems with the lungs, for example, COPD or asthma, for which they need to be on steroids on a consistent basis, those patients are at high risk of contracting this and getting bad disease when they contract this. So those patients populations are at the
obvious. I'm going to probably just interject. Smokers, they would probably be
yes,
more prone to it as
actually that has been added as an indication for pneumonia between age of 2 and 64 years of age.
Okay.
Chronic alcoholism and smoking has been added as
so alcoholism too. No.
Yes.
And is that just because it's depleting immunity? Is that what's going on with that we can suspect?
I am not quite sure about that.
Yes.
What was the reason? But chronic alcoholism has consistently associated with poor nutrition and low immunity. Smoking has high risk of having problems with your lungs. So I believe those are the associations which make it think.
So when we look at how you look at who's at risk and that type of stuff, obviously, is there any way to prevent? And that's one of the biggest things that I think that as we do these shows and that type of stuff, what can people do to take action steps to prevent that type of experience and that type of sickness? Sure.
Immunizations is the one part where you can do, which is the prevention part, and then second piece to it is treating it at the earliest.
Yes.
So immunizations of younger than 2 years old, as per CDC recommendations, and more than 65 years of age with pneumococcal vaccination, that has consistently shown benefit, and I think we should follow that strictly. Immunizations of people between 2 and 64 years of age who has any end organ damage, liver failure, kidney failure, heart failure, or lung problems, history of chronic alcoholism, and smoker, they should be vaccinated with those vaccinations. Then comes the personal hygiene. Frequent hand washing, that helps, and just routine exercise and eating healthy diet. So those never fail.
Never fail. And time and time again, all the shows we do, it always comes back to exercise and eating well.
Yes.
And is one of the major steps into this whole thing. I think it's something that's often minimized and understated, as I've seen these shows kind of unfold. If somebody would present with signs and symptoms, or is having signs and symptoms of, like, we'll say pneumonia and that type of stuff, and they would present to your office, what's your role? What do you do? What could they experience?
So as we discussed before, there are symptoms which can overlap. So we like to take comprehensive history, which kind of give us a differential diagnosis, and examination kind of give us an idea about how we're going to work up that patient. We typically get started with chest X-ray, and chest X-ray is first line of investigation, and in combination with examination, history, and chest X-ray, we are able to kind of formulate the treatment plan. There will be cases when we will have to send patient to hospital for further treatment, because pneumonia is a serious disease. It can, if it is severe enough on X-ray that it needs IV antibiotics, we might have to send people to hospital. But in most of the cases, we are able to treat patient on outpatient basis. We'll put somebody, we'll put them on antibiotics and have them follow up with the primary care doctor.
Sure.
And just give them some instructions to observe for. And
Gotcha. So, well, as we were doing some preparation for this, how contagious is it? And how does it spread?
Well, it's spread through droplet infection.
Okay.
When we speak, there are very fine droplets which are in our sputum. They get spread in the air around us. If we keep about 3 feet of distance, the chances of contracting disease from other people are low.
Okay.
Coughing, sneezing can make it spread.
Okay.
So cover your cough, cover your sneeze, maintain a distance, and if you are with somebody who has these symptoms, standing on the side rather than standing on the front is a good idea.
Last question is that, which I also find amazing, is that can you explain the awareness that people may or may not have that there are vaccines for pneumonia?
Yes, actually, there are a lot of people who are not aware that there is a vaccination of pneumonia.
Correct.
And I think as a medical provider, and it's important to educate people.
Absolutely.
When they come for other problems, that this is something which can be prevented rather
Sure.
than treated. Can be prevented with vaccination.
Absolutely.
And I think about only 1 in 6 people get vaccinated for pneumonia, right? And I think we can do a little better job there.
And I think that, the other thing I was impressed with as well is that only about 20% know there's a vaccine even available. So, 1 in 6 is low, but when you think about 20% of the population in America that only are aware of it, or 80% that don't know that it's out there, that it's even an option, I think that's something that we need to do better from our public health standpoint to make sure that people are aware. Absolutely.
Absolutely. Yes.
So, as you kind of think about everything that we just discussed here, what is your take-home message that you would like to give our viewing audience today?
I think there are 2 pieces to it. One is prevention, and of course we should follow CDC guidelines and focus on immunizations and targeting right patient population. And then second piece to it is early diagnosis and treatment, especially in vulnerable patient population.
Absolutely.
So if somebody has mild fever, chills, yes, we can observe it for a couple of days. But if somebody is getting short of breath with that, spiking high-grade fever, night sweats, they should get it checked right away.
Absolutely. Dr. Singh, thank you very much for being a guest on our show.
Thank you for inviting me. It was a pleasure.
Yes, you provided a lot of great information. So, again, my name is Dr. Fred Sylvester. Good day and good health.